Hello everyone, once again welcome to my IT channel. Today we will see one role play explanation. This incident happens in emergency department and you are talking to one baby's mother. So the task is you see a parent who has brought his or her 2 years old son to the emergency department because he has swallowed a button. You are going to see the child in triage but are talking to the parent first. The child is not present for the discussion. So before going to the exact task, you have to read the scenario and underline relevant points. So you can come to know that you are talking to the parent. So it is a second degree talk. So you have to take care while talking. Then you are going to see the child. That means you didn't examine the child yet, but you are getting some information from mother regarding the incident. Moreover, the child is not present for the discussion. So these many things you have to keep it in your mind, and moreover, it is happening in emergency department. So you have to be fast in talking somewhat. Okay, then next we will go to the task, find out the reason for child's visit to emergency department. So it is an unknown scenario, so you can just introduce yourself, greeting with introduction, then you can ask to the parent regarding the visit. So we can start like this, good morning, then get back the good morning. Okay, get back the greeting. You can just inform like this. I'm Rashmi Rajan. I'm the nurse in charge today for you. I can understand that you came here for your child. May I know your name and how may I help you today? That's enough. Then the answer will be, good morning sister. Actually, my name is Maria. I came here for my 2 years old child. As you told me, yes, it is correct. Actually, I came here with my son because he swallowed a button. So I'm so much panic regarding his condition. Then our next task is explore any physical effects on child like nausea, vomiting, fever, stomach ache, and find out more details about child's ingestion, how long ago, size and material of the burden, any action by parent, any food or drinks, etc. So they have given many things to ask. So we can just we can split and we can ask. So of course, after knowing patient's condition, we have to give reassurance. We can tell like this. Oh, Miss Maria, I'm really sorry to know about your baby's problem, but don't need to worry. He is in our safe hand. But before proceeding further, may I ask you some question? May I get you some for getting some more information about your baby's condition? Then the parent will tell you, yes, you can. Then we can ask, for my better understanding, could you please tell me whether he experiences any nausea, vomiting, fever, or stomach ache? Then mother's answer will be no, nothing like that. Then we can ask about the burden. We can ask, Miss Maria, could you please tell me? And you told me that your baby has swallowed the burden, right? And how long ago he has swallowed that? And could you please tell me the size and material of the burden also? That two questions we can ask together. Okay, we could not ask all together. Two questions we can ask together. Then the answer will be, sister, actually this is a small button. Actually, I was working in the kitchen and he was playing there. And he suddenly swallowed something, and I could see that many buttons were scattered there in the nearby area, and he swallowed one among that. And it is a plastic, and it is size like maybe 1 centimeter in diameter, maybe. Then the next question will be, okay, fine. And Miss Maria, what you did? Have you done any action for that? And have you given any food or drink for him? Then the answer will be, actually, I just tried to take out the burden from his mouth, but I couldn't. He swallowed completely. And actually, I asked him to drink water. He drank it. So that is nothing. He drank it normally. So that will be parents' answer. Then the next task is explain next step. Vital signs to be taken. Then returning to waiting area, examination by doctor, decision on appropriate treatment, then find out any questions or concern. So we can tell that, okay, thank you, Maria, for your information. Actually, now I'm going to check his vital signs, and you can just wait in the wait in the waiting area, and it's followed by examination by your baby's doctor. He will take appropriate treatment for that, because my observation, I can see that he's stable and nothing is there to be worried. And moreover, you told me that there is nothing. He swallowed already. He drank the water, right? So nothing is there to be worried, and I can see that he is breathing normally. So no need to worry anything. Just I will take his vital signs, and you can just wait in the waiting area. Is it okay for you? Then we can ask, do you have any more concern? Then mother's question will be, it is rest giving waiting time. Example, depend on priority cases, availability of doctors, child is stable, no airway problem. So the possible question, there is possible question that could you please tell me when the doctor will come, how long I have to wait here. Then we can tell that, oh really, I'm sorry Miss Maria, I could not tell exact time when he will come, but no need to worry, I will get him as early as possible. But I can reassure you that your baby is stable, because as I told you, there is no airway problem and there is no other signs and symptoms. So I will get your baby's doctor without any delay. Is it okay for you? Like that we can give the reassurance. You should not tell that it is very busy, there are many cases, doctor will come after attending, like that. No, you could not tell like that. We can always reassure the parent. Even the baby is stable, we have to reassure the mother. Just you can wait here, but within minutes I will get him. And I can reassure you that your baby is stable. There is no other symptoms, like that. Then the next task is emphasize child, not priority case, because no physical symptoms, signs of distress, no risk of damage, internal bleeding, but unlikely to pass through system naturally. Then establish parents' consent for you to take child's vital sign. So we can tell that. Then we can ask, is it okay for you? Then mother may tell that, sister, really I'm so much worried because he swallowed a button. So I'm thinking that maybe he will have some breathing problem, or maybe he will be in danger. We can tell that, Miss Marie, I can truly understand your concern. Being a mother, it is quite natural to feel like this, but I can tell you that your baby is not in severe case. Because his symptoms, physical symptoms and signs, physical symptoms and every signs and symptoms, it is suggestive he is stable, very stable. There is no risk for any damage or internal bleeding also. And because he swallowed completely, it didn't go to the respiratory tract, because if it is in the respiratory tract, of course he will show respiratory distress or breathing difficulty. But for your baby, everything it is seems to be normal. So if it is in the gastric system, it's automatically when he will open his bowel, it will come outside. So nothing is there to be worried. So you can just wait here, means I will get the doctor very fast. It will not take long time. I'm reassuring you once again. I'm reassuring you that it will not take long time. So do you have any more concern? Then mother is telling that it's okay, fine. It will not take long time. Means it's okay. You can wait for him. Then we can ask her, I hope I have clarified all your doubts, and if you don't have any other question, may I proceed with his vital signs? So that is the conclusion actually. Then mother's answer will be, yes, of course you can do. And then thank you. That's enough. So this type of question you can expect in first role play. It is like a convince only, nothing else. There is nothing else inside. The content will be convincing of mother. So as much as possible, you have to give reassurance that baby is stable, no need to worry anything. You have to rationalize also, because his vital signs, I mean, you are going to check the vital signs. With the vital signs, you could not explain anything. This is before vital sign checking. So you have to tell that he is not showing any signs of respiratory distress or breathing difficulty. Moreover, he is looking good and well. So nothing. If the button goes to the respiratory tract, means of course he will show some signs and symptoms. So we can understand. For your baby, of course, it will be in the intestinal tract only. So it will come like automatic, like normally. Like that, you can give the reassurance. So in this type of questions, you have to keep it in your mind to give reassurance, because you are talking to a parent. So accordingly, you have to give reassurance then and there, and you can include mother's conversation. That will be effective for your talk. It should not be a monologue, it should be a dialogue. From both sides, the active conversation should be there. I hope it is clear for you. We will see with another one informative video. Until then, bye, take care.